We are bracing ourselves because this year it will, it's not a question of whether it will be bad.
A Houston baby suddenly airlifted 150 miles here to Temple to get treatment for COVID-19.
That's because many major hospitals in the Houston area are packed and running desperately low on hospital beds. Our Jarrell Baker joins us live to give us an update.
Guys, I'm here at McLean Children's Hospital, and when I was talking with their staff, they said they're providing respiratory support to the baby, and they said she's doing just fine. They're also saying, unfortunately, she's not the only case in there. Now, they're saying that they're seeing more kids come up and fill up their hospital beds with COVID ever since they've seen a rise in our area. An experience no parent wants to go through. A Houston family's 11-month-old baby girl airlifted nearly 200 miles away from home. The Baylor Scott & White's McLean Children's Hospital in Temple to receive treatment after contracting COVID-19.
Not only her COVID infection, she was also suffering from a seizure from the reports that we got.
Hospital staff say the child is pulling through, and the parents are happy she's being treated, even though it's a long way from home. According to the Houston hospital, McLean's was the best and closest option they had.
The emergency rooms at our major children's hospitals here in Houston, the home of the largest medical center in the world, are extremely crowded. They are filling, if not full.
Dr. Dominic Lucia with McLean's Children's Hospital says they're assuming the baby has the Delta variant due to the spike in cases across the state.
We have also been working through capacity challenges because the amount of sick kids that we're seeing, and that's not just COVID, that's the other things that I mentioned, along with the summer pediatric trauma issues that we typically see and a large viral load within the community.
Dr. Lucia says the bed space is an even bigger issue at their adult hospital, where they're managing bed space for now, but as the number of hospitalizations keep growing by the day, it could get out of hand.
With school starting and there being no consistent rules on the masking available, it worries us that we're going to see a lot more sick kids and experience capacity issues for months to come.
Dr. Lucia says the plan is to keep monitoring the child and update the family about her condition. Dr. Lucia says that they're also seeing a rise of kids catching COVID cases across the nation. And he says that's why it's important to take the precautions seriously, wear a mask, get vaccinated if you can, and also social distance. Live in Temple, Jarrell Baker, 25 News.
Jarrell, thank you. Staff with McLean Children's Hospital plan to limit visitation while COVID numbers are rising. So if there aren't enough beds for one person in Houston, how many beds are there in Texas? The Department of Health says that there are 450 ICU beds available in Texas and almost 8,000 hospital beds. In Service Area L, which covers the Bell County region, there are only 4 ICU beds available and 74 hospital beds. In Service Area M, which covers Waco, there are only 13 open ICU beds and 108 hospital beds, and that's only 17 ICU beds for over 800,000 people. COVID patients are currently making up about 18% of all hospital patients in both regions.